Above all, stay una house as government don't advise. Stop unnecessary waka about. So make we not spread this virus.
Coronavirus. No be only big man like me they catch you. If it catch anybody, even poor man yourself fit to get am. So make we join hand together. Take stop with this deadly disease where they kill our people and they never get a cure.
Together, we go overcome if we do all the things where they tell us to do.
To you and welcome to the news on the network service of the NTA. We thank you for joining us. I am Lydia Ojije Ochi. The Nigeria Center for Disease Control has confirmed another 148 new cases of COVID-19 in Nigeria on the 5th of May at 11:40 p.m. Lagos has 43 cases, 32 in Kano, 14 in Zamfara, 10 in the FCT, 9 in Katsina, 7 in Taraba, and 6 in Borno and Ogun states respectively. Others are Oyo with 5 cases, 3 in Edo, Kaduna, and Bauchi respectively. Adamawa and Gombe have 2 new cases each, while Plateau, Sokoto, and Kebbi have 1 case each. With this update, confirmed cases of COVID-19 stands at 2,950 in Nigeria, 481 discharged, and death stands at 98. The federal government has approved a 2-month license fee waiver for terrestrial broadcast stations in the country. Information and Culture Minister Lai Mohammed announced this at a meeting with members of the Broadcasting Organization of Nigeria in Abuja. Anthony Forsen was there.
The waiver, as approved by the federal government, the Information and Culture Minister said, is part of initiatives to serve as palliatives to cushion the effects of the hardship board members are going through in the face of the current pandemic.
I make bold to say that while board members have been hit very hard by the effects of the current pandemic, they are not alone. In fact, the entire creative industry, which also covers the broadcast industry, has been affected by the pandemic and has inflicted extensive damage on the economy of nations across the world.
To this end, the minister explained that a committee has been set up to look into the situation and advise government appropriately on the best way to mitigate the effects of the pandemic on the industry.
Therefore, there's no doubt that we need a collective and government-supported approach in dealing with the immediate short and long-term palliative and initiatives for the industry in order to mitigate the effect of the pandemic on the sector.
Vice Chairman Broadcasting Organizations of Nigeria, Godfrey Ohuabunwa, explained that the impact of COVID-19 pandemic has greatly affected the economy and way of life, creating platforms for nations to review their survival strategies.
While we appreciate the efforts of government in tackling the pandemic, we urge for government intervention so as to save the sector from imminent collapse arising from declining revenue.
Bond, however, used the opportunity to commend the Nigerian Center for Disease Control and all frontline workers in the fight against the pandemic. In Abuja, Anthony Forson, NTA News.
More enlightenment is still required to clear the doubt and myths about the coronavirus pandemic. This is the position of Gombe State Task Force on COVID-19 while briefing on the protest by patients at the isolation center in the state. Correspondent Emmanuel Akila has more.
People who tested positive for COVID-19 at the Kodom Isolation Center in Gombe State broke out of isolation to protest for what they call better care for one of them sick with injury, and they believe that they are not sick with COVID-19. We blocked the road because one of us is sick with cancer and we want her to be taken home. If we don't take action, as she dies here, it may be alleged that she died of coronavirus. People from the community hosting the isolation center came out in large numbers to join the protesters. While some believe that COVID-19 is real, others say they don't. In its regular briefing to give update on the disease, Task Force on COVID-19 in Gombe State lamented the action of the people who tested positive for COVID-19 and the community who joined in the protest, describing the action as catastrophic.
People talk about democracy or whatever. This virus does not understand any of that.
We need to, improve on the level of, enlightenment.
At the time of this report, Gombe State has 101 confirmed positive cases of COVID-19. In Gombe, I am Emmanuel Akila, NTA News.
Joining me live from Gombe is the State Commissioner for Health, Dr. Ahmed Mohamed Ghana. Honorable Commissioner, sir, we thank you for joining us. Now, let's talk about the protests by COVID-19 patients in isolation center in Gombe, in your state. Please tell us more about the protest.
Well, it was an unfortunate incident that happened yesterday, that some of the confirmed COVID-19 confirmed cases came out and barricaded the road on the premise that one of the patients there, one of the occupants there, had a very smelly wound, and so they drew our attention, and we promptly went there, in a bid to evacuate that patient to a safer location. But of course, it deteriorated into, a kind of a skirmishes, and which we came to understand that it was kind of an orchestrated and mischievous, attempt by some of the disgruntled people there, for the obvious reason that they simply do not believe that COVID-19 is true, that it truly exists. So it's a very big, serious issue, because despite all the state government effort towards getting the state very prepared and the very massive, social and public enlightenment that we have embarked upon for the last 2 months, there's still a big chunk of our population that do not believe that this disease exists. They think the government is just concocting numbers, that we're just accumulating numbers and ultimately looking forward to get some money from the federal government. This is unfortunate, and I don't think it's going to be a positive thing, in the containment of COVID-19 across the entire population.
Okay, Commissioner, sir, what is the situation right now?
Well, the situation is quite calm. We were able to evacuate that lady yesterday out of camp, and of course, based on the terms that we must take that lady to back to her base in Billy. Of course, we agreed, but then of course we took her straight to a health facility in Billy under the custody of the medical officer, and then of course the police and the traditional ruler, were all informed, and we're continuing to treat that lady. We'll continue to look at the issues, at the camp, But I think what is becoming very obvious is the fact that COVID-19 is not just a health issue. It is a social issue, a psychological issue, an economic issue. It's a multifaceted, a multidimensional, problem and crisis that the whole world is facing. And I think we have to evolve, and re-strategize so that we address this, very multifaceted nature of the disease, such a way that we can, come to terms with the issue.
Okay, now, just finally, tell us what other measures have the state government put in place to contain the spread of COVID-19?
Well, the government is very, it has deployed all the arsenals within, our disposal in terms of making sure that all the isolation facilities are ready and the, health facilities, the workers have been trained, they have been deployed, and they are already functioning. Security, apparatus across the entire state is working assiduously to ensure that, cases that are coming into Gombe State are, kind of checked. If you look at the numbers that we have in Gombe State, which as at the last time was 88 from NCDC, 100% of them were imported cases, mainly from Kano and then to some extent from the Lagos and Kano. And the effort of the state government is actually what has culminated into diagnosing these cases, even before they got into our community. And so if you look at Gombe State, it's relatively, in terms of, signs and symptoms of COVID-19 within the community, you can hardly find that because we've been able to pick these people at the earliest point, at the point of entry, and then we've been able to isolate them. And this is, active case search, which many states have not really been doing. And that's why you have such a high number in Gombe State. It's because the state government has been very proactive, because we've been able to check, people, the influx of people that are coming into Gombe State, and we're able to isolate them. We're able to go on contact tracing, and that has basically, ensured that our community is still largely free of COVID-19. And you've not that, unlike what's happening, in places like Kano. One of the reasons why the Kano situation has gotten out of control is simply because they were not testing. And despite all the difficulties that we have here in Gombe, we are very far away from any testing laboratory. Every day we have to fly between Gombe, 600 kilometers from Abuja, to just take a sample. Even if it is just for that, we have to go every day, and then get this result back into Gombe. So every day we've been doing this. The state government has been running helter-skelter to get NCDC to come and support us to have, a testing facility in Gombe. This has not really come to fruition. And if you look at Gombe, it has bounds with all the 5 other states in the Northeast geopolitical zone. So this is the place to have a laboratory, because people go into all these and a lot of the burden that the state government is shouldering, we're doing that at the instance of the other 5 states. And so this is clearly a justification that the federal government needs to step into Gombe before it becomes a disaster, in the Northeast region.
Honorable Commissioner, we thank you. It's good to know that the state is doing a lot to contain the spread of the virus. Thank you for sharing your thoughts with us on Nationwide.
Thank you very much.
Thank you. We had been talking with the Commissioner for Health of Gombe State, Dr. Ahmed Mohamed Ghana. Governor Abubakar Atiku Bagudu of Kebbi State has directed security agencies in collaboration with the state COVID-19 task force to quarantine persons coming into the state from all entry points and mandate the wearing of face masks at designated places in the state. The governor announced this while briefing newsmen shortly after a closed-door meeting with the State COVID-19 Task Force Committee in the state. Usman Abdullahi Shehu reports.
Governor Abubakar Atiku Bagudu said it has become necessary for government to continue to take stronger measures to checkmate the spread of the deadly virus in the state. The governor, who recalled the circumstances surrounding the first death of the COVID-19 victim in the state, said the deceased was taken from Usmanu Danfodio University Teaching Hospital in Sokoto to the Federal Medical Center Birnin Kebbi, where he was admitted under false pretense case by his people. The victim, according to Governor Bagudu, absconded the hospital and died at home after his sample was collected before taking him to a designated isolation center. The governor explained that 8 out of the 10 new cases in the state, as announced by the NCDC, were contacts made by the deceased.
This incident that just narrated that have led to these 8 positive cases illustrate how easy it is for innocent others to be exposed tragically, and quite often in the line of duty by one failure or recklessness to adhere to all the advice that is being said.
Governor Atiku Bagudu similarly announced that the state government will distribute palliatives to all vulnerable persons to ease the hardship arising from the measures adopted. In Birnin Kebbi, Usman Abdullahi Shehu, NTA News.
Enforcement of face mask in Lagos State. Let's join Hingino in Lagos for more on Nationwide. Hingino, you're next.
Thank you, Lydia. The Lagos State NYSC has again supported the state government in the fight against COVID-19 by donating preventive kits and other palliatives to both government and residents of the state. Nosa Usula reports that the State Commissioner for Special Duties and Intergovernmental Relations, who received the preventive kits on behalf of the state government, urged them to continue to be good ambassadors of the nation.
Across the world, governments, private organizations, and philanthropists are contributing immensely to the battle against COVID-19. In Nigeria, as various individuals and organizations contribute their quota towards containing the spread of coronavirus, the National Youth Service Corps is playing a key role by donating locally made preventive kits to state governments across the country.
When they get this palliative from us, that they should also be encouraged to do this kind of thing whenever they have the opportunity to.
The commissioner noted that the proactiveness of the Corps members in supporting the state government in its fight against the spread of coronavirus is commendable.
Allow me to commend one more time the NYSC, especially our Corps members who again have done it. They did it before for the sanitizers and the hand wash and the gloves and so on. Now they've done it one more time.
NYSC coordinator Eddie Megwa said the Corps members' call to service brings out the passion in them towards supporting government.
They are not only here to teach, to train, to develop their community. They are also here to feel the way they are feeling in this pandemic period.
The Corps members also visited Ifako, Ijayi, Agege and Oshodi Isolo areas of the state where palliative materials were freely distributed to the residents of the areas. In Lagos, Nosa Usula, NTA News.
And few days after the partial relaxation of the lockdown, Adeola Komiakere reports on the level of compliance by Lagos residents with the use of face masks and the rules of social distancing.
Following President Muhammadu Buhari's nationwide broadcast on gradual ease of the 5-week lockdown to enable the gradual reopening of the economy, the Lagos state government announced a new set of strict guidelines that must be enforced to prevent a rise in new COVID-19 cases. The rules include the compulsory wearing of face masks and maintenance of social distancing, especially in public. It was observed that about 70% of people in public wore their face masks, although some had them under their chin or in their pockets.
I have. It's written here.
They pay me for here, that's why I come out and say make I take breathe more.
It's not convenient for me in terms of breathing.
Meanwhile, street vendors hovered around selling their wares.
It is sealed before you can open it, and I don't allow people to test it until you buy it.
In terms of public mobility, the social distancing directive is being flouted as some commercial drivers convey more than 60% passenger capacity as instructed by Governor Sanwo-Olu.
People sitting down for people don't care about their life
because there's scarcity of vehicle right now.
Some passengers who spoke off camera called for enforcement in this regard as the drivers are placing their lives at risk. In Lagos, Adeola Komiakere, NTA News.
That's it from Lagos. It's now back to you, Lydia.
Many thanks, Hingino. We'll now join Mie Ogidi, and he's at Lugbe Market, and want to see what update he has for us on activities there. Mie, if you can hear me loud and clear, looks like the weather is changing. What's the situation there since the ease of lockdown?
Thank you, Lydia. Wednesday and Saturdays are the coronavirus-induced market days in the Federal Capital Territory. And this Wednesday is quite a special one because this is the first Wednesday after the partial opening of the Federal Capital Territory. We have been to some markets, some metropolitan markets like Wuse, Lugbe, and Otako. They complied with the directive. They opened from 8 a.m. to 3 p.m. And some measures were really taken. For instance, children below the age of 11 were not allowed into the market, and the aged were not also allowed into the market. And those that were allowed access to the market, they made it compulsory. You wear your face mask, and the temperature check was compulsory. So from there, we drove down to a mini market here anyway in Difere, in Lugbe, not at the heart of Abuja, but here is like it's free for all. No measure is taken. Face masks, if I may mark them, just 20 over 100 wearing of face mask in this market. And this fruit market here, they sell even live chickens and others. As you can see, even both the buyer and the seller, they are wearing nothing. And at this other side, you can see my friends. They're in the cluster, and social distancing is not in their dictionary. As you can see, as if they are in a club kind of. And obviously, the chairman of the market is also among the group, or I may say the cluster here. So let me hear from him. Why are your guys not wearing face masks?
My name is Adamu Usman. I'm chairman of Lugbe Fruit Market Association. I want to extend my special thanks to our president and the federal government.
Just tell us, why are your guys not wearing face masks?
I'm not too clear about the question.
No, why they wear this thing where you
okay. Some of them have it, some of them doesn't have it, because this rule started from last day before yesterday.
So how many times do you open this?
So we started opening from day before yesterday, from 6 o'clock to 8 p.m. Is it a.m.? So, but before per week we are opening at 3 daily, from 10:30 to 2 afternoon, so that we are closing it.
But the government said that you open market 2 times a day. So what? Okay, so I think that is the much we can take from here. So, leader, it's back to you. You can see this is a different world. Thank you very much.
All right, Amir, before you leave there, you should at least teach him how to wear the face mask properly. We'll now take a break for... Okay, we'll now take a COVID-19 update. We'll join them live, the PTF briefing. Let's join them live now.
As the Minister of Aviation, the Minister of Humanitarian Affairs, Disaster Management and Social Development, and an update from the Honorable Minister of Information and Culture before we take your questions. I now invite the Secretary to Government of the Federation and Chairman of the PTF to please make his remarks.
Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, good afternoon, and to our viewers at home and in your various offices, I say a good afternoon. I welcome you to the national briefing by the Presidential Task Force on COVID-19 for Wednesday, the 6th of May 2020. We were unable to hold this briefing yesterday because the Presidential Task Force on COVID-19 had to brief the leadership and members of the House of Representatives on progress of our national response. Today marks 100 days since the index case of coronavirus was reported in Nigeria. Ever since, and especially after the inauguration of the Presidential Task Force on COVID-19, Nigeria, along with other countries of the world, have been plowing through uncharted territories in our effort to contain the spread of the virus. Guided by the leadership of Mr. President, the National Assembly, the cooperation of the sub-national entities, and supported by the sacrificial commitment of our frontline health workers, the media, the private sector, our security agencies, religious, traditional, and community leaders, as well as a greater majority of Nigerians, the Presidential Task Force on COVID-19 has been pursuing a multi-sectoral national response. We deeply appreciate your support in this fight. The briefing of the Presidential Task Force to the House of Representatives, I must report, was very robust and fruitful. The interaction allowed for a comprehensive assessment of the public health situation in Nigeria, and we received assurances that necessary synergy will be strengthened and legislative interventions effected. The Presidential Task Force thanks the leadership and members of the House of Representatives for the guidance and demonstration of leadership in this era of a public health emergency. Early assessment of the ease of lockdown phase indicate that Nigerians are yet to come to terms with the deadliness and the virulent nature of the COVID-19, and this gives us concerns on the high possibility of increased seeding of the virus to hitherto unaffected persons and populations. Some of these areas of worries include the following: non-compliance with social/physical distancing guidelines evidenced by the higher than ordinary level of congregation of persons in banks, traffic gridlocks, especially at entry points to metropolitan areas, and disregard of guidelines on carrying capacity of our motor vehicles and tricycles. Increased level of interstate movements worsened by the dubious concealment of people in food-carrying vehicles. Unhygienic and ill-advised use and sharing of masks, especially multiple fittings, before buying from the vendors. Once again, we appeal to the governors to please align their plan for the movement of the Almajiris with the ban imposed by the President. We shall intensify our dialogue on these matters with them. Ladies and gentlemen, I want to reiterate the fact that our individual and collective safety is in our hands, and I re-echo my call and appeal to Nigerians to demonstrate our duty to ourselves and loved ones by minimizing the risk of getting infected by the virus. As we continue to push the frontiers of risk communication, I wish to appeal to all Nigerians to be vigilant and desist from taking undue risk. The Presidential Task Force recognizes the challenges earlier encountered at the bank. We, however, assure you that the Central Bank of Nigeria, as well as the Bankers Committee, have put in place strategies that will reduce such reoccurrences. I therefore plead with Nigerians to be patient and schedule their physical appearances at the banks. On the other hand, I wish to repeat my call to the banks to also quickly address issues related to difficulty with using their online platforms, especially revalidating expired ATM cards, amongst others. In view of the fact that public transportation is a major clustering area through which the virus can easily be transmitted, we call on the leadership of various transport unions to properly enlighten their members on the dangers associated with non-adherence to the COVID-19 containment guidelines. We also urge them to educate their members on the ban imposed on interstate travels. Tomorrow marks the last day for the enforcement of the closure of Nigeria's airspace to flights. We have assessed the situation in the aviation industry and have come to the conclusion that given the facts available to us and based on the evidence of experts, the ban on all flights will be extended for an additional 4 weeks. The Honorable Minister of Aviation will give you details during this briefing. We have continued to interface with the governors, and I am pleased to inform you that the Nigerian Center for Disease Control will be visiting the Kogi and Cross River states to provide support to the state EOCs. This is a giant leap in the dialogue and collaboration process. We are also retooling all federal medical institutions as part of the overall support to the states. We have received a boost in the isolation facilities available in Abuja with the completion of the Abuja This Day Dome. This facility will be inaugurated by the grace of God on the 12th of May 2020. The Presidential Task Force, and indeed Mr. President, is deeply worried about reports on the increasing rate of infection of medical doctors and personnel. While we renew our efforts at training these frontline workers about the infectious nature of this virus, we urge that utmost care be taken in managing COVID-19 related cases. We have similarly received reports about the emerging situation in isolation centers in Gombe, circulating in a viral video clip. We have investigated, and I wish to assure you that the Nigerian Center for Disease Control team is on ground in Gombe to support the state EOC. Similarly, I can confirm that the testing laboratory in Gombe will be activated soon. The overall assessment of compliance with the measures and outcomes of modeling we have developed point in the direction of danger ahead. We therefore need personal discipline, increased awareness, and enforcement. The Presidential Task Force calls on community, religious, and traditional leaders to take up this challenge. Similarly, we call on trade associations, professional bodies, and organizations to complement the efforts of government. The Presidential Task Force appreciates your effort, but it has become very obvious that more needs to be done together. While we continue to advocate strict compliance with the prescribed measures, the Presidential Task Force urges Nigerians to also use this period of the pandemic to build social solidarity by eschewing stigmatization, support the mental well-being of our compatriots that are infected, continue to provide for the poor, sick, aged, and the vulnerable, and to provide support in whatever manner. I will now call on the Minister of Health, the DG, Nigeria Center for Disease Control, and the National Coordinator to provide updates on new developments. Similarly, the Ministers of Aviation, that of Humanitarian Affairs, and Foreign Affairs will brief you after we have taken the technical briefings. I thank you for listening. Thank you.
The Secretary to the Government of the Federation, Honorable Ministers here present, Director General, Directors, ladies and gentlemen. The number of confirmed COVID-19 cases in Nigeria has continued to rise, not unexpectedly, in view of prevailing circumstances in certain states of Nigeria. As at midnight yesterday, the 5th of May, 148 persons had tested positive, bringing the total to 2,950 confirmed to have COVID-19 in 34 states and the Federal Capital Territory. 481 persons have been discharged, and 98 COVID-19 related fatalities have sadly been recorded. The 148 new cases were reported in 17 states as follows: 43 in Lagos, 32 in Kano, 9 in Katsina, 10 in the Federal Capital Territory, 14 in Zamfara, 7 in Taraba, 7 in Borno, 6 in Ogun, 5 in Oyo, 3 in Bauchi, 3 in Edo, 3 in Kaduna, 2 in Adamawa, 2 in Gombe, 2 in Plateau, 1 each in Sokoto and Kebbi. We are clearly in community transmission phase, where much now depends on individual and collective behavior, and the urgency of behavior change communication becomes apparent. Knowledge so far gathered about COVID-19 needs to be converted into practice, because our safety, now more than ever, depends on all of us. We are to adhere to public health advisories, the wearing of our masks, observing social distancing, practicing hand washing or sanitizing, standard respiratory hygiene, avoiding crowded places, and also avoiding all manner of non-essential travel, as well as reporting when we feel unwell or someone close to us has symptoms of infection. If not, we expose ourselves and our loved ones to risk and inadvertently increase the period this virus will be with us and make life worse for all of us. For example, large crowds reported at certain events, and the movement and repatriation of persons from one state to the other do contribute to the problem and do not indicate a good understanding of the urgency of this situation. Therefore, I again appeal for considerate and responsible social adjustment to the challenges which Nigeria faces. While we are striving to increase our testing capacity, we have noted the complaints about turnaround time to get the results of tests conducted. NCDC is doing all it can to resolve these issues. We have also continued to train and retrain our healthcare workers, as well as provide them with the necessary personal protective equipment. The The reported cases of infection in Kano are a case in point, showing the urgent need for intensifying training, particularly among healthcare workers. It is clear that many doctors and nurses who are not familiar with the protocol for infections of this caliber will benefit from the training. Community mobilizers have been deployed at the grassroots to continue to sensitize our people through the National Primary Healthcare Development Agency. I participated earlier this week in a teleconference of the Northern Traditional Leaders Committee organized by NTA, in which the need for urgent engagement of all traditional, religious, and community gatekeepers was emphasized and agreed on. We are encouraging and supporting states to increase the number of isolation centers nationwide and also the quality of the isolation centers. And we're extremely grateful to corporate organizations and philanthropists who have donated isolation facilities, diagnostic equipment, commodities, and sundry supplies relevant to our response effort, to COVID-19 threat. One example is the This Day Dome, which has been repurposed by donors to be a 300-bed isolation center with a 10-bed ICU unit, which is to be commissioned next week and significantly ease the availability of bed space. With regard to Kano, much progress has been made in collaboration efforts with the State Ministry of Health and the EOC to restore routine medical services to hospitals, to improve the confidence of the doctors and health workers, and to further drive the ongoing investigations in the state. Organized ambulance service is already in operation, bringing relief to citizens who need to access medical service, especially at odd hours and in view of restrictions of movement, and also in emergency situations. The Federal Ministry of Health is sending supporting teams to Sokoto, Katsina for training, capacity building in case management and infection prevention and control in a hospital setting. Other states shall follow at short interval to assist the state ministries of health in their response to this threat. This training is particularly important because we cannot afford to lose the services of healthcare workers at the rate it is going. We have also received donation of an incinerator, which will be installed at the Aminu Kano University Teaching Hospital for effective waste disposal, particularly of these infectious materials. I wish to appreciate the effort of our traditional rulers again, our religious leaders and community leaders in sensitizing our people to the importance of compliance with COVID-19 infection prevention measures. I remind everyone that this is even more critical as the restrictions to movement are being relaxed. The value of the tentative easing of the lockdown, which was announced by His Excellency the President, depends on population adherence. I urge all citizens to practice and use various media options available to them to propagate and support the guidelines issued by the PTF. We again recognize our frontline and backroom healthcare workers, the caregivers, hygienists, security, drivers, porters, and others for their tireless efforts to continue to adhere to self-protection regulations. I also thank all those citizens who adhere to infection prevention and control and non-pharmaceutical intervention advisories, and urge you all to propagate it to your neighbors. Thank you for listening. I shall now invite the DG of NCDC.
Chair of the Presidential Task Force, Honorable Ministers of Health, Honorable Ministers, gentlemen and ladies of the press. Obviously, I normally only refer to the Honorable Minister of Health, but this is a slightly different scenario for me, so bear with me. I will return this week to trying to address specific areas of the response every day, so to inform you and educate the public on the work that we're doing in various aspects. And today I'd like to focus a little bit on data and why it is so important to drive our response with data and the responsibility we have in collecting data and using it for every aspect of the response. Data is critical, from our surveillance to our lab, for our logistics, supply chain, for risk communication, for rumors, and I'll try and explain. After the Ebola outbreak in 2014-15, one of the biggest lessons that we learned was that we needed to collect electronic information on infectious diseases in Nigeria. At that time, information was collected on paper forms, translated into Excel sheets, and merged somehow at the state and at the federal level. So we started a gradual process of developing a new tool we called SORMAS. It's called the Surveillance Outbreak Response and Management and Analysis System, SORMAS, that we have used to collect data from health facilities up to the local government, to the states, and to the national. At the time COVID-19 started, through various interventions, scratching around for funds from here and there, we had managed to implement and deploy this tool to 22 of our 37 states. Since the beginning of the outbreak, we have worked very hard with partners, with the UN, especially with the European Union, who has specifically supported this project, and our colleagues in a university in Germany to continue deploying this tool. This tool is now the reason every night you see updated data from all the states in Nigeria on the number of new cases, number of suspect cases, number of lab tests. You know, it would have been impossible to do this level of analysis with paper and Excel. So within the outbreak, we have continued to improve the deployment of this tool, and we will now use it to continue analyzing the information we have in order to make decisions. We can tell you of all the cases, who their contacts are, how they are linked, as much as we know, and really use this on a day-to-day basis to make public health decisions. The other data tool that we have deployed recently is a data tool for logistics and supply chain management. So for the first time in any response, we can tell our leaders in the PTF, in the ministry, where every single mask that we have distributed in Nigeria has gone to, from where it has come from to where it has gone to. So when there was a lot of uproar in the social media about the Jack Ma donations, you know, which in effect was actually a very small part of the total donation that have come into our distribution and supply chain, I was very confident to tell everyone that we can not only give details for where every single mask, every gown, every boot has gone to, every single bottle of sanitizer that we have distributed in Nigeria, we can tell you exactly who has received it, what date you have received it, the time, and who signed off on it. The third example I want to give is on risk communication. We have a fairly new platform which we call an event-based surveillance platform. It's called Tatafo, with which we use to manage and monitor rumors in the country. We use this to look around social media where new rumors are emerging in order to respond to those rumors. Because our responsibility, like the Honorable Minister of Information will always say, is managing two outbreaks. One real outbreak and one outbreak of misinformation that goes out every day. So we know when there's an emerging rumor on a fake cure somewhere across the country. We then develop a targeted response to that specific rumor and make sure that we inform Nigerians that this is not true, this is the alternative, and this is the reality. So we understand that our responsibility is not only in managing the current outbreak, but also managing the misinformation around the country. The other thing, in the beginning of the outbreak, we implemented a tool to manage and monitor all returning travelers in Nigeria. So once they came into the airport, our 5 major international airports, of which only 4 were functional, of course they were then distributed around the country. So we could tell every state in Nigeria, Kwara State, you received 50 travelers returning from 1, 2, 3, 4 countries. These are their names, these are their contact addresses. Please follow up on them every day. So each of these travelers were followed up for 14 days on return. Not by us at NCDC, but people in the states where these people had gone to. All this would not have been possible without our data systems. And finally, what are we now doing? We're working with a group of modelers from around the country, coordinated by University College London, where a colleague, a Nigerian, is coordinating all the modeling groups, bringing them together, using our own data to now try and project with us where the epidemic is growing, where it's going to go, not only with our case data, but with other variables that we collect from other sources of data across the country. Using data to make informed decisions every day on where to invest resources, where to implement and accelerate the response. Without these tools, we will not be able to make the critical decisions that we're making. So in conclusion, as we manage this outbreak, data management is very important. There have been a bit of criticism in various aspects of our ability to manage data for several other parts of the response. The critical thing is not where we are today, is how we can use whatever deficiencies we have to keep improving the system every day so that we can build our response and we can continue to guide the actions we take. This is a new virus. It means that the data points that we're trying to collect are not always very clear, so we keep improving, and every day we learn from our mistakes, and we hope to have an evidence-based scientific approach to the response in order to guide our actions now and in the future. So data remains at the heart of the response, and this, obviously, like we've always said, is a marathon, not a sprint. We'll keep improving as we move forward, and we hope that with time, we'll be able to share with Nigerians through various publications, through peer review and non-peer review papers on how the response has evolved, how we have learned, and how we have used what we have learned to improve the response. Thank you.
The chairman of the Presidential Task Force, members of the Presidential Task Force, ladies and gentlemen of the press, good evening. The Presidential Task Force continues to be very concerned about the level of compliance with the eased lockdown guidelines that we introduced last week across the country, but most especially in Lagos. We have called on state security agencies and state structures to provide support and supervision that will ensure compliance to the eased lockdown guidance. In this regard, we are appealing strongly to the public to cooperate with the state security agencies in the interest of public safety. There's a very good reason why the PTF eased the lockdown last week. One, it was partly because we wanted to provide an opportunity to cushion Nigerians, and by extension, an opportunity for businesses to re-establish some economic activity towards the gradual reopening of the Nigerian economy. Secondly, we also had a bundle of measures which we realized, if fully implemented, if fully delivered by everybody, would have the same impact as that of an absolute lockdown. I must emphasize that the COVID pandemic in Nigeria is far from over. Our chances of coming out of this crisis sooner rather than later depends on our absolute compliance to the ease lockdown guidelines. The guidelines have specific aspects within them that I would like to emphasize. Apart from the mandatory overnight curfew nationwide from 8 p.m. to 6 a.m., we have also provided guidance to banks with regards to access and ensuring that physical distancing applies, as well as rules around mass gatherings. We have provided guidance on opening times for buses and motor parks, for construction sites, and for restaurants, where we have allowed restaurants to operate only as take-out services, with no eating inside restaurants allowed. In terms of case management, we would like to again appeal to state governments, particularly those who are yet to ensure the provision of isolation facilities, to please make sure that they have at least 300 beds available per state so that they can isolate persons that are positive with COVID infection. It is particularly important that when it comes to isolation facilities, that appropriate prioritization is placed on those that have mild or no symptoms. This group of persons with COVID infection should not be placed in a hospital environment. They are better off being placed in a non-hospital environment, such as hotels, where they will be comfortably looked after because they do not require any specific monitoring or treatment. And it will be much cheaper for state governments to adopt this approach for the 80% of those that will be positive with COVID infection, and allow hospital beds and medical facilities to be used for those that require them most. In terms of other issues, I would like to again emphasize the need for us all to take personal responsibility for our health, as well as the health of our loved ones and our community. We need to be aware of our physical space. We need to be very observant of the persons around us and of the need to maintain physical distancing, as well as avoiding mass gatherings. We must do everything to prevent another spike in the spread of the virus during the eased lockdown phase. In terms of additional information, I just wanted to let the public know of our website, which is www.statehouse.gov.ng/COVID-19. We can also be contacted via email, which is ptfcovid19@osgf.gov.ng. Finally, I would like to acknowledge contributions from the following organizations: Flood Relief Fund, Tagaco Chemicals, Mercury Industries, and a wide range of Nigerian citizens who, in their own individual way, supported this cause. Thank you for your contributions and support.
Thank you. We have concluded the technical phase of the updates. We'll now take, in the following order, the Honorable Ministers. The Honorable Minister of Aviation, followed by the Honorable Minister of Humanitarian Affairs, Disaster Management and Social Development, followed by the Honorable Minister of Foreign Affairs, and finally, the Honorable Minister of Information and Culture. Honorable Minister of Aviation.
Gentlemen of the press, good afternoon. Certainly in civil aviation, we are in very difficult moment like everyone else. All of this started because someone traveled and unfortunately came back home with it. And the consequence is what we've been going through. So we are very aware of our responsibilities and the weight attached to this. We are worse hit than any other sector. Some 17 billion monthly is being lost by the airlines thanks to COVID-19. The sector is highly regulated and very coordinated and has set standards that must be followed at all times, regardless, because they speak to safety. So safety, security, and efficiency of the sector is extremely important regardless of what is going on. We would not be able to just open up after closing for several weeks and perhaps for some months, to open up and start businesses as usual. There are safety issues concerned. Typical example, you keep your car stagnant and perhaps maybe put it on jack or on stone and grease it and leave it, and you come back 6 months, you want to kickstart the same car, you develop problems. So those airplanes have been kept. When we are going to bring them back into service, we will ensure that they are airworthy and that they can make those flights and safely. So also the flight crew, those people flying the airplanes, they have certain standards they must conform with. They have their licensing issues which would come due or fall due for recurrency to be done within this period. So what do you do with them? Certainly, they won't just pick up their bags and continue where they left. They must conform to those standards and ensure that they are safe to operate, both in terms of their medical health and in terms of their proficiency to be able to conduct a very safe flight. So there are also other issues like the state safety programs, and that must be adhered to. There are protocols that we developed for the COVID-19, which included the social or physical distancing, use of masks, washing of hands, and other protocols. So we have to train the industry people to be able to conduct such activities. Also within the aircraft itself. Yesterday during the briefing at National Assembly, House of Reps, I explained very simple issues like the cabin crew, whose role is to keep you alive, not to serve you tea. Serving tea is complementary to what they do, but to keep you alive. And these people need to keep physically distant, need to also be trained, need to be told what to do in case of emergency or somebody showing those signs in flight, and so on, which is a possibility. All of this and several other activities need to be done for us to open flights to become regular. And we're not alone. We are in a world of aviation. There is only one aviation, Aviation B. What obtains in Canada obtains in Burundi. It's the same thing. So we need to conform to all of that. However, we didn't fold our arms and do nothing. We have developed requirements that we need to ensure that it's done. The NTA, which is the regulator, has been in touch with stakeholders, and we're developing the how to come back to businesses. Certainly, we feel very sad. We want to come back more than yesterday because if you look at what is going on, all of the income of that sector depends upon when you fly. And we're not able to do so. So this is really weighing on us heavily as an aviation industry. So we try the best that we can to resume as quickly as we can to ensure that the resumption is safe, resumption is secure, resumption is very efficient, and in the manner that we keep all of us safe and secure. And finally, I think maybe it's the time when we can explain one or two issues. But I think maybe due want of time, we can do that lately. But just to say that aviation, we have a roadmap that we are running that is approved by Mr. President. And since we started approving and implementing that roadmap, we've seen tremendous amount of improvement. To the end of 2018 Q4, aviation becomes the second fastest growing sector in the country after water and sanitation. And Q4 2019, which just finished, aviation is now the fastest growing sector in Nigeria. This is the MBS figures, Nigerian Bureau of Statistics. So we believe that the roadmap we are running is taking aviation to the greater heights and is adding to the GDP and to the general well-being of our economy. So we want to come back quick, we want to come back in safe, secure, and efficient manner. Thank you.
Honorable Minister of Humanitarian Affairs.
Good afternoon, ladies and gentlemen. I wish to make a few remarks to bring us up to speed on the recent activities, interventions, and plans of the Ministry of Humanitarian Affairs, Disaster Management, and Social Development. In the time since I was here last, we have made progress on the overhauling of the homegrown school feeding program, and sensitization has already begun in the 3 frontline states of Lagos, Ogun, and the FCT, which were in readiness for full implementation. And the overhauling was sequel to a March 29, 2020 directive from Mr. President directing the Honorable Minister of Humanitarian Affairs, Disaster Management, and Social Development to identify modalities on continuation of the school feeding program during the COVID-19 pandemic across the nation, even in lockdown state as at then. Following this directive, the ministry, in collaboration with the state governors, identified the distribution of take-home rations as a feasible method of achieving this directive after exploring many options and following consultations with state governments and sundry partners. The plan was adopted with implementation now set to begin. The program will therefore be carried out based on data provided and structures put in place by participating states through the homegrown school feeding program, with support from partners that include the World Food Program. A press release with program implementation details will be disseminated to the media very shortly. On Tuesday, May 5th, 2020, the ministry, in collaboration with the World Food Program, convened a Zero Hunger Roundtable with leading lights of the private sector. And these participants included Tony Elumelu, Tony Cole, Indidi, Onwuneli, and many others. The roundtable was convened in recognition of the fact that in times of crisis, hunger is a byproduct, and despite concerted efforts by the government and the business elite, much more needs to be done to put food on the table of the most vulnerable in our society. Aside from other interventions, the federal government has released and handed over 14,910 metric tons of grains from the strategic grains reserves to Lagos, Ogun, Kano, and FCT till date. Deployment is ongoing to the other remaining frontline states. 35 states and the FCT have received varying numbers of trucks of rice distributed by the Nigerian Customs Service. Through the Nigerian Customs Service. We are now working with the World Food Program and the private sector to tackle the challenge posed by hunger, because we believe that collaborations will foster better outcomes. As you may be aware, at the onset of the pandemic, the National Social Register contained data of over 2.6 million poor and vulnerable households with over 11 million individuals across 34 states and the FCT. With the accelerated registration and rapid expansion, the register has now grown to 3.1 million, equivalent to 13 million individuals across 35 states and the FCT. In addition, the ministry has finalized processes for the development of the COVID-19 Rapid Response Register targeting the urban poor, semi- and peri-urban areas. This register will use existing databases from the National Communication Commissions, BVN, from NAPES, SMIDAN, etc., and synthesize these databases and filter the information to then register these individuals into the Rapid Response Register for immediate support as directed by Mr. President. Finally, the ministry will be unveiling our new strategic direction soon. The overarching objective is to institutionalize the current social investment program into an integrated program so that it is sustainable into the future. Thank you for your time, and I'll wait for questions that might come up. Thank you.
Honorable Minister of Foreign Affairs.
Good evening, Chairman, PTF, Honorable Ministers, members of PTF, distinguished members of the media. So I would like to take this opportunity to brief you on the situation with regards to the evacuation of Nigerians back to Nigeria. As you all know, there was a flight that's supposed to be coming in today from Dubai. And, well, it's good news and maybe not so good in a way. One of the passengers, a lady, had a baby on the flight, or went into labor in the flight. And so the plane had to turn back. And happy to say that mother and child are doing very well in hospital. And the arrival time has been rescheduled to 7 p.m. This evening. So the flight is still expected. And arrangements have been made. One of the big challenges that we have is, of course, the hotels want to be paid up front. And it's not always that easy to manage all that. But we're pushing hard, and as again, cannot thank enough the governor of Lagos State helping in the process of keeping them, still willing to receive. So hopefully we'll get the money through to them by the time the passengers arrive. Then there's another flight that we had arranged for Friday. British Airways from the UK, and so there are one or two issues we're having there. Again, it's a question of payment, and they're sticking very strictly to timelines that are very difficult for us to manage. But what we've done is we've quickly rearranged for another standby airline in case the British pull the rug from under our feet and decide that they're not going to proceed with a Friday because of some fine details in the agreement. So those Nigerians that have paid, if that happens, we'll have a plane to still bring them. So there won't be any great loss from that point of view. A trending story at the moment is that the government has not been patronizing Nigerian airlines. Nothing could be further from the truth. We did a bidding process when it was decided to go and collect our nationals outside, and we restricted it to Nigerian airlines. I mean, there were some foreign airlines that also bid, but we made sure that we selected the Nigerian airlines. So that process is ongoing, because one of the issues there was, again, the question of payment and what government could do to subsidize with these airlines. But they point to the fact that there's an Emirates flight that's coming, and then there's a British Airways flight that's coming. Well, the Emirates airline that's coming had nothing to do with government. As I pointed out in an earlier intervention, the government of the United Arab Emirates, on its own initiative, decided to start evacuating foreigners that were in the UAE, and to all different countries, not just Nigeria. And they, informed Nigerians there who are desperate to come home that there are these Emirate flights available, and that it will fly once they fill up the plane. And Nigerians spontaneously, without any reference to the government, immediately started buying tickets, because they're all desperate to come home. That's how the UAE flight came into being. And the British Airways one, as I said, was also because this plane was coming already to Nigeria to come and collect British nationals here. And we thought that since our people were there, crying out, that, we should take advantage of that. But otherwise, we are patronizing, and we want to patronize. And Nigerian Airlines, I have been in touch with all of them, Max Air, Asman, Air Peace, all three of them. We have 4,000 people there outside wanting to come in, and we're hoping, and it's easier for us, we prefer for our airlines to be the ones that are bringing them back. They also have to be proactive, and dynamic in also going out. They cannot just sit back and wait for government to allocate these, because our people are desperate and they're ready to hop onto anything that flies that can bring them back to the country. But we've given directives out. I've given personal directives to our people in the US, for instance, to get in touch with Nigerian Airlines and see the ones that can come and give them timelines in which to deliver. So that's really the position of government. A big constraint, of course, is hotel accommodation, for them. So as much as we would want all these airlines to be going out and bringing, it's not possible. I'm giving the DG NCDC a grayer hair than, the hair that there is there. Very great with the numbers that are coming in, because they have to cope and they cannot cope. They're very stretched. So, so we can only bring in as much as we can manage. But we're doing, everything possible. Of course, there are also questions that one is being asked about, if people who are brought into Abuja, who live in Lagos or want to be in Lagos, how is that going to be taken care of? But, with the Minister of Aviation, I'm sure we'll find a solution, to address that. Our first priority, and I believe the first priority of the Nigerians outside, is to get back home to the country. And then, once we're in, we can now start, sorting out, which particular domestic locality the different passengers wish to get to. So thank you very much for your kind attention.
Honorable Minister of Information and Culture.
Mr. Chairman, members of the PTF COVID-19, gentlemen of the press. You will recall that on Monday, I was asked about a journalist, Kufri Carter, who was arrested and detained in Cross River State. In Akwa Ibom State. I did my own checks on the issue, And I can confirm that Mr. Carter, a journalist with the radio station XL-FM in the state, was indeed arrested following an interview with an unnamed doctor over the state's response to the COVID-19 pandemic. My investigations revealed that Mr. Kufi did not use the interview, which reportedly defamed the state and the governor on the radio station he works for, but instead published the interview on his Facebook page. He was subsequently arrested and charged to court, and he was granted bail. Unfortunately, he has not been able to meet the bail conditions. Hence, he remains in custody. As the issue is now in court, there isn't much anyone can do about it except persuade the state, or if the state decides to withdraw the case. I'm in touch with the State Attorney General, and I will continue to see what we can do about the matter. Thank you very much.
Thank you. That closes the updates from the ministers. We are now ready to take your questions. Are we set? Okay. All right.
Okay. Good afternoon, sirs, members of the Presidential Task Force on COVID-19. My name is Yemi Adebayo from AIT. Well, I want to start with the Minister of Information. We appreciate your efforts on the case of Mr. Kofi Carter, but would plead with you to actually help us to reach out to the state government in time and see what you can do to free our colleague. Away from that, I want to ask you, sir, earlier today you announced a committee comprised mainly of comedians and entertainers to advise governments on the impact of COVID-19 and the nature of palliatives for the broadcast industry in Nigeria. Sir, the only representation in the committee is Ajasa Ibrahim of Broadcasting Organization of Nigeria to represent the broadcasters. But sir, the majority of members of this committee are online media owners and entertainers. Do you seriously feel the composition of this committee is such that can address the peculiar needs of core broadcasters in Nigeria? And should broadcasters whose reporters are on the front line of news gathering spread across Nigeria be grouped into this committee, comprised mainly of the entertainers? I want you to respond to that. Then the other minister of the health minister and the DGN said this, now that the lockdown has been eased, there is need for testing in Nigeria, which has been the major issue. And I want us to remind us of that last month, the Federal School of Medical Laboratory Science in Jos produced and donated hand sanitizer, which the Honorable Minister is quite aware of. I want to find out, sir, is there a way the PTF in any way considering adopting that center, that particular school, as one of the testing centers to actually accelerate the process of testing in Nigeria? Then, just before I go, sir, a minute, sir, I also want to find out from the Honorable Minister of Foreign Affairs, as the Nigerian High Commission in the UK outsourced the collection of payment of flights for Nigerians to be evacuated from the UK to an individual with the name Josephine Ochepa, who now sends email to those Nigerians via an email address known as nginUKevacuation@gmail.com, asking them to make payment to his accounts. I want to find out if government actually taking this decision. Thank you, sir.
My name is Felix Onwa. I'm from Reuters. My question is for the Honorable Minister of Health. Nigeria, which has 15% of Africa's population, has so far carried out 2% of testing. Why is it so, sir? And is it because we have an accurate shortage of testing kits? Secondly, sir, Nigeria has also just 350 ICU beds and 500 ventilators. Is this number expanding? And why is the number so low? And finally, what proportion of the deaths in Kano in the last 2 weeks will you say is related to COVID-19? Thank you.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ode. I report for Arise News. And my first question really is for the National Coordinator. Unfortunately, I can't see his face due to the podium. But we need clarification on the curfew, because there's been a lot of complaints, especially from health workers and even journalists like myself, because some of us close as late as 10 p.m., some midnight. And even here in the FCT, the officials are saying this curfew has no exemption. It doesn't matter if you are a medical doctor or a journalist, you're not allowed to move around. So we need that clarification from you. And the next question is for the Minister of Health. Well, all of this controversy is concerning what is happening in Kano. We'll be put to rest when we get the official report from Kano. So far, what do we know about what is happening in Kano, and when should we expect the full report from you as well as the members of the PTF? And the chairman of the PTF, this one is for you. Well, it still talks about looking for local solutions to COVID-19. We want to really find out, have we tried to put to test any of the solutions that different people are bringing forth that they have for this coronavirus, okay, between you and the Minister of Health, really? And have we tried to put any of this test, what they've claimed? We've seen the Oni of Ife, we've seen some medical doctors say they've come up with cures for coronavirus. Have we put them through a trial to find out if they are potent or not, or we're just dismissing them because they are from home? And finally, well, the chairman of the PTF, they said you should consider changing the nomenclature from isolation centers to treatment centers, since we're speaking about stigmatization against those who have been confirmed. And this is a comment from the chairperson of the Albino Foundation, and he's saying the Minister of Humanitarian Affairs, his members have not received any palliatives, that he is the chairman of people living with disability. No palliatives for them, so we need your comments on that. Thank you.
Good evening, sirs. My name is Juliana Taiwo Baloye. I write for the Sun newspapers. This is for you, SGF, Information Minister, and the coordinator. You might wish to, just a follow-up to what my colleague said. The question is, are journalists and delivery vehicles of newspapers no more included in the list of essential services providers? If they are, please, why did the Commissioner of Police in Lagos State instruct area commanders and DPOs to stop journalists from returning home on Monday and yesterday? Foreign Affairs Minister, this is for you, please. A Nigerian living in Johannesburg says, aside the professionals, 80% of Nigerians living there are artisans, businessmen, technicians, and traders. He said things have not been easy because of the lockdown, and they are not generating any revenue, but landlords are asking for rent. But they are excluded from palliatives that the government there is sharing. So he's asking, what can the PTF or the ministry do in terms of diplomacy to help to address this, their plight? Minister of Education, this is for you. We understand that some tertiary institutions are already giving parents deadline to pay for the next session. A student enrolled in the University of Ibadan Distance Learning Center said they have been given June as the deadline to pay their fees, which must be 100% payment, without which students will not have access to the portal for study materials, nor allowed to write exams. He also wants to know what the government can do to address their plight. Thank you.
Good evening, sirs and my colleagues.
My name is Hassan Umar Farouk. I report for Liberty Radio and Television. My own goes to the chairman, sir. Coronavirus is really a test of leadership, not only in Nigeria, but worldwide, sir. No trained and licensed health worker with conscience will allow the patient that rushed to his facility to die if he has the competence, skill, and equipment to manage such case. At the onset of this pandemic, the Ministry of Health excluded private health facilities from managing COVID-19 cases. If I'm right, effective management of patients start with correct diagnosis, sir. Unless certified and accredited to NCDC. It is recorded that over 70% of sick Nigerians visit private health facility for their health care need, if nothing else, for the proximity to their local environment. This is a fact, sir. These private health facilities are more in remote areas where a majority of Nigerians reside. The earlier some of these private health facilities are empowered at least to test for COVID and repair on time, the better of our morbidity and mortality indices will be. Please, sir, this blanket exclusion for private health facilities is, if not reviewed, will be counterproductive, sir. Thank you very much.
Good afternoon, Chairman and members of the PTF and Nigerians at home. I am Itaire Ikben of the NTA. My question is to the DG of the NCDC. The plan to test 2 million Nigerians in 3 months means you'll be testing an average of 22,000 persons per day. And as at the last update you gave us, we test about 2,000. We carry out about 2,000 tests per day. So how do you intend to scale up to 22,000 per day on the average going forward? And again, will the criterion for testing still be that one exhibits symptoms of coronavirus, or anyone can walk to a test center to get tested? And I want to also ask you, sir, what's the composition of the reagents which is used for testing, and why is it impossible for it to be produced here in Nigeria? Is it that our chemists are not equal to the task, or they have not been sufficiently challenged? And also on the issue of the security, also the issue of the curfew, some of our colleagues complain that the security personnel do not recognize the media as essential workers during curfew hours. So please, I don't know the orientation they have, and we want the PTF to look into this. Thank you.
Good afternoon, sirs. My name is Friday Okerigbe. I'm a reporter with Channels TV. I would like to direct my first question to the Minister of Foreign Affairs. It has to do with the plight of Nigerians who traveled to China before the lockdown. The information we got from some of them says they are being requested to pay 700,000 naira. And many of them have return tickets with Ethiopian Airways. So the question now is, why are we not exploring, why are we not approaching the Ethiopian Airways, which they have already had agreement with, they have return tickets, so that they can come home and pay for the isolation center, because they are saying that they cannot pay 700,000 naira for a new flight and also come back to Nigeria and have money to pay for the isolation centers. The second question, I would like either the Minister of Health or the DG NCDC can actually take it up. It has to do with the welfare of those in isolation centers. The videos that we make reference to yesterday that happened in Gombe, it was alleged that it was a case of poor welfare. And yesterday we have calls from the isolation center in Gogwalada here of another person there who was alleging that is also poorly treated. In fact, he said he had no access to food outside, and he was given 1 meat pie for a day on one of the days. Apart from that, he said the due date for his second test elapsed 5 days ago, as at yesterday. Nobody had come to meet him to take sample for second test. And when he approached the doctor told him they have run out of test kits. So I'd like you to respond to that. And I also noticed that this month alone, out of the 98 fatalities we have recorded, unfortunately, my calculation shows that we have actually recorded over 40% for this month alone. What is actually responsible for that? Thank you.
Good evening. Good evening, the SGF, honorable ministers and my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My question is for the Honorable Minister of Health. Sir, since we started recording discharge cases in Nigeria, have we had any relapse? And if yes, what's the number or percentage? And what's the Federal Ministry of Health doing about it? Secondly, you said earlier that about 80% of people that tested positive to COVID-19 recover without intervention. For the death recorded, are they all severe cases that needed the use of ventilators? And for those that need those cases of ventilators, how many of them died? Those that were on ventilators. Thank you.
Good evening, SGF, honorable ministers, and the DG and my colleagues. My name is Femi Akonde. I'm a reporter with TVC News. Yes, my colleague Friday asked a question similar to mine about the incident that happened in Gombe. But I would want to know if there are standards or specifications in terms of comfort provided for people in isolation center or treatment center, as some people would want to call it. Because some people are even saying that apart from Lagos State, most and some other states, a handful of them, most isolation centers are not really conducive for persons with confirmed cases of COVID-19. Please, I would like to know if there are standards you give to the state government. I know that the NCDC is not in charge of running some of these isolation centers. And this question is from an Abuja-based journalist, Leon Usigbe. He's asking the chairman of the national coordinator of the task force. He says, how does the interstate restriction affect conveyance of corpses? Morgues are full because people can't bury their dead. My mother's body has been in the Maitama District Hospital, Abuja morgue since the 5th of April. As a Catholic, she ought to have been buried within 2 weeks. We need to take her to Uromi, Edo State, for burial. What do we do? And the Minister of Information, thank you very much for following up on Kufre Kata's plight. I asked the question on Monday. Thank you, and we hope soon he will be freed. Thank you.
Good evening, all. Rachel Abuja from the News Agency of Nigeria. My first question is for the Minister of Health. Please, sir, I would like to know how much it costs for treatment for a single COVID-19 patient. I would like to know the amount. My next question is for the NCDC DG. Now, in order to scale up testing, some countries are adopting pooled sample testing. I don't know if we're looking at that area. Meanwhile, I would like you to answer my next question, sir. There are allegations that some of your staff are collecting money for tests to be carried out, and is a sum of 35,000 naira. And the last time I checked, you said testing is free in Nigeria. My last question is for the Aviation Minister. You made mention of 17 billion lost monthly. Is it in naira or in pounds or dollars? Thank you very much.
Thank you. We have taken all the questions for the day. They have been directed at the Honorable Minister of Health, the DG NCDC, the National Coordinator, that's on the technical part. Then we'll be taking responses from the Honorable Minister of Aviation, Honorable Minister of Humanitarian Affairs, Disaster Management and Social Development, Honorable Minister of Information and Culture, Honorable Minister of Foreign Affairs, Honorable Minister of State Education, and the SGF. We shall begin the technical part with the Honorable Minister of Health.
So thank you for the questions. As I've recorded them, the first one is about the laboratory in Jos, if they should be carrying out tests. Well, first, I'm not sure if they have a PCR machine. If they do, then it is then based on the demand, the need, because if you already have one at, for example, at Jos University Teaching Hospital, and it is not fully utilized, then you will not send another one to a laboratory in the same town. We send it somewhere else, another machine somewhere else where the need is more urgent. But if the caseload is so high, as you have in Lagos, you can have 2, 3, 4 centers. These machines are utilitarian, they are not for decoration. So if the need is high, yes, there's justification for having 2 or 3 in a particular location or municipality. The other question is about the rate of testing, that we have 15% of Africa's population and do a very small percentage of testing. I've said before that the strategy which was applied in Nigeria is different from other places. At the beginning, we were doing very smart and selective testing, as we called it, and later on expanded it when we got into the phase of community transmission to broaden the training, the parameters and the conditions for training. And I think the DG of NCDC will say more about that. It's about the strategy that we are using. Then the other question is about us having 350 ICU beds and 500 ventilators. If the number is increasing, yes, it is increasing. We have some on order. And we're also getting from countries, you all remember that the US president promised Nigeria some ventilators. We also got a letter the other day that the government of China is also sending us another load of relief of materials for attending to COVID-19, among which I believe there will be ventilators also. So it's a question of fitting them to our, particularly our tertiary hospitals, both our teaching hospitals and our federal medical centers. But again, the ventilators go with specialized manpower. You must have an intensive care specialist, a critical care physician who will be trained, and we are escalating that training now. We are doing crash courses, courtesy of the Society of Anesthesiologists of Nigeria, to make sure the capacity is there all over the country to operate these machines properly when the need arises. But I must also add that without drawing any conclusions, the number of persons who have required IC, who have required ventilators so far is very, very small, very few at National Hospital, but we hardly had any case that really needed. I know, I think it was Gwagwalada, but the need for those who have serious manifestations has not been more than adding oxygen. So if you add oxygen to the air they breathe, it has worked. The fatalities that have arisen from the COVID-19 in Nigeria are largely, overwhelmingly connected with pre-existing diseases, kidney disease, high blood pressure, cancer, other diseases like TB and so on. So they are connected to underlying or age, people who are not able to build enough immune immune antibodies to be able to tackle the virus, so the virus wins. So the need has not been very high, and as I've wisely heard from His Excellency President, we must have all of this, but pray that we don't need them or we don't use them, which is what we look at. Now, the question about, if I understood correctly, whether primary healthcare centers can treat COVID-19 and private hospitals, we have said that the conditions must be met for private hospitals to handle COVID-19. They must be inspected, they must be purpose-fit, retrofitted, and also accredited. If they meet those conditions, yes, private hospitals can handle COVID-19. Primary healthcare centers will probably not have the manpower and also not be ready to do that, but I can imagine that if they have enough rooms, they can be converted for use as isolation 1, where you carry out observations. And let me say again that the manifestation of COVID-19 in some people is so mild and is so sometimes with no symptoms, so that all you need to do is to have them in a facility so that they are not able to transmit the disease. Although they have no symptoms, they can transmit. So for the period of observation, and after the 14 days or a little bit more, they are tested, they are negative, they can leave. But these are the people who are most difficult to manage because they don't really feel sick, they don't have any symptoms, they feel very well. Many of them will argue with you that they are not sick. If they are sick, they must have symptoms. And if you are holding them there, you must give them medicine. But in reality, the medicine you give to people is palliative, is just to get over a fever or a headache or cough, and you treat the symptoms. You don't really treat the virus. We don't have medicines that actually destroy the virus yet. Only your antibodies that you build in your system will now destroy the virus if you're able to build antibodies fast enough and in sufficient quantity. If your system can't do that, then of course the virus will win. But for those who have very strong immune system and young people, agile people, they don't feel they're sick, so they're quite difficult to handle. And you can see in the video clip that went around from Gombe, many of them look very fit and very able, and you really think that there's nothing wrong with them, and they also think there's nothing wrong with themselves, but they are able to transmit, and that's why it's a very risky category. And we keep appealing to people, even if you have those symptoms, to cooperate. And you may not necessarily need medicines because you really don't have a symptom, but if symptoms pop up, you'll be giving those medicines. Now, the question of welfare in isolation centers, we are still at the beginning of all of these problems, so they are teething problems, and I believe that many states will begin to improve on their delivery ability. There are some, of course, who have never really operated isolation centers before. No country was ready for this. You will see that in some foreign countries, even developed countries, patients were being put on the floor. It happened. We saw them in videos, and some of them they had to put on the veranda and so on. So all countries were overwhelmed. And in our own case, our health system it's not just a weakness, it's just that the ability to cope under the circumstances that you find yourself. So the question of poor welfare, I believe all states will address as time goes on. As with the question of a cure, well, I also already talked about the cure. It's contained in what I just said just now. The traditional medicines that have been given to us, or rather not given to us, but that people say they had. We have referred to the traditional complementary medicine department of the Ministry of Health, and to the Nigerian Institute for Pharmaceutical Research and Development to evaluate. But some of them who have written to me that they have the medicine have asked me to give them 10 patients so that they can cure them. Give me 10 or give me 1 so that I will cure him and you will see that it works. But we don't do it like that in medicine. We don't have human guinea pigs that you give to somebody to cure, to prove to me that it works. I should give you 10 people's lives, which is, it doesn't work that way at all. So anybody who knows that you have a cure, you must prove to me that you actually tried it and that it worked. And many of the cures people tell you they have never tried it on anybody at all. They just say they have it. And of course, I'm not going to give them anyone to go and carry out their tests. So that's why they have to go through the research cycle to be sure that, number one, this medicine is not toxic, because they are traditional medicine. Any kind of medicine can be toxic. So you must make sure your patient is safe. The toxicity will be checked. And then you can also check the efficacy. Does it work or does it not work? So those are things that will be tested. And as you all know, the process normally is you try it on animals, on rats, on mice, and so on, and you can try it on larger animals and before it is certified, and then you do clinical trials on volunteers. People volunteer, and before you go through the process. It's a whole process by itself. Now, the question of relapse, have we seen relapse? I don't think we have seen a relapse in Nigeria. We have seen cases where it was difficult, it took a longer time for them to start testing negative. So if it took a longer time, like 80, 20, 30 days before they started testing negative, we have seen things like that. But that somebody was cured and had a relapse, I'm not aware of that. Now, increasing the facilities, yes, we are working with states to help to increase the facilities available. And then somebody has a question about the increasing fatalities also. Well, if you notice that the large number of new cases, a large number of the incidence is high, and we have a large number of confirmed cases now. Proportionately, there's an increase in the number of those who have been successfully treated. Proportionately, there will be an increase in the number of fatalities. It's increasing proportionally, but generally, the case fatality rate has remained about the same. So it is not that one is outpacing the other, but it can fluctuate within a certain margin. And as we said before, they are generally connected to pre-existing diseases that the person had. Again, another problem we have is that there are people who stay in their home, they suspect they have this disease, or in fact they have even been diagnosed. But instead of presenting themselves for treatment, they go into hiding. And they hope somehow, or take medicine, native medicine, I don't know what they do, but by the time it's getting very bad, that's why they rush to hospital. And by that time, the situation is really bad. There are some who even just barely reach the doorstep of the hospital, and before going through the process of even telling what your name is, some people have been lost that way. I have a report of someone who, as he managed to drive to the IDH, Infectious Disease Hospital in Lagos, managed to drive there, and he opened the door of his car, came out, and I think he went to get something and collapsed. And he was, that's an example of someone who waited till last minute, trying to cure themselves with some other means. So that one adds to the fatalities that we have, which we need not be that way. So we have already talked about the use of ventilators. Relatively few have ever been used here. We don't want, but we keep to prepare, continue to prepare for the. Now, about the standards and the comforts, again, that depends on the state and also the ability of them to cope with the number that are coming in, but they do get help from the government in the design. There are standard designs, correct, and the NCDC was instrumental in designing the standard isolation center in Gwagwalada, which had not yet been completed, but I think is ready to be used now. It's probably ready by now to be used, but they are using another facility which is serving the purpose. Yes, they are standard designs, and all these are designs that were put in place even before COVID came out. So there's also a plan that the PTF is preparing to have isolation centers in all states, and also ICU centers, so that the idea of being unprepared does not catch anybody on the wrong foot again in future. So as for the treatment costs, well, I've just said that for those who have those symptoms, it's just like a 14-day stay and feeding, and perhaps vitamins and so on. And then for those who have a very intensive treatment over 20, 30 days with high, some people, you have to treat other illnesses, you have to treat the hypertension along with it, or the kidney disease or whatever they came with. So some people who had pre-existing diseases, you have to treat both. So the cost varies intensely, but if we ask the various hospitals, they can give us the figures and that's what it cost them. So we already have some figures, but they were not disaggregated into each, how many, what it costs for A, B, C, D. It was not like that. Thank you. I think I've answered all my questions. I can't hear you from here, please. Okay, yes, okay, yeah, all right, good, I saw that. Thank you, I missed it. Now, as far as Kano is concerned, the ones that have been described as unexplained deaths, the investigation is going on. There's a specialist pathologist that we sent in the team to go to Kano to work on this, and the report I got yesterday is that they're working along 3 lines of investigation, 3 streams, to make sure that nothing is missed. The final report is not out, so they're still working on it. Unfortunately, the head of the team who had gone to Kano was misquoted seriously, as I would say that is 80%. He never said anything like that. That has since been retracted, and they have apologized to him. He didn't say anything like that at all. And but the result is not yet in. The jury is not yet out on that. The investigation will continue. Is this Kano State government and then the federal government carrying out these, using also ex-consultants and trying to find out what really happened there. When the report comes out, it will be made known. Thank you.
So thank you very much. I think all the questions today are on testing. The Honourable Minister has already answered the first one on the proposal for a new testing centres. I think our guidelines are very clear. What I'm happy about is this week we have a team looking at Owerri, Port Harcourt, Owerri and Anambra, as well as another team in Gombe and Yola. So very soon we'll have 5 more labs, hopefully if everything goes well, because sometimes we go to a lab, they're not ready, we tell them what to do, 1, 2, 3, 4, 5, and they have to come back in whenever we have time to send another team. So that we're inspecting labs doesn't mean that they will all get accredited. So, but then 5 locations this week, and we keep pushing for other locations. In terms of testing numbers, yes, when we say 2 million over a 3-month period, I mean, it's too simplistic to divide that over 90 days and arrive at an average per day, because we're scaling. So we'll start from the baseline where we are, and we'll get to the numbers where we want to get to. It's still dependent on the supply chain, but there's nothing that we're working harder on every day. This morning I was with Sani Aliyu, seeing how we can push the Global Fund to accelerate the deployment of some of the gene expert reagents down to Nigeria. So we're all working very hard to accelerate that. And once we do that, then we will scale. The scaling will now mean that we have the reagents to test. Getting the samples in will depend on a collective effort with state governments and everyone across the country to make sure that the samples are actually collected. Friday had a question on... Friday, can you remind me of your first question before I get to the pooling part? Okay, I think the Honourable Minister has answered that question, but you know, the state governments are trying very hard to solve this problem. The FCT, I know, is working very hard to make life as comfortable as possible for our patients in the treatment centers. Other states are trying. You know, in some of the states like Gombe, they went very quickly from 0 to a high number of cases, so they're catching up. It was the same in Lagos. If you remember, in the very early days, it was a bit of a struggle. Then they normalized and stabilized, and now they have a supply chain of food and all of that. So it's a challenge when you have in Kano 50, 60 new patients coming into the treatment centers that have just been established. So just like we're working on the supply chain for reagents, states are working on supply chain for drugs, for food, for water, for airtime. And I'm confident they're really trying to make life possible. Yes, there have been some challenges in Gombe. All of us saw that video. It wasn't the most pleasant representation of the efforts. But you have to remember, in every negative incident that is shared, there are untold stories, 80%, 90% of work that is going on. And you hear from the testimonies of those that have left the treatment centers how well they were treated. So yes, it's a struggle, it's a big country. To get 100% right across every treatment center across the country is not easy. But I speak to the state governors and commissioners. I know that everybody is trying to make life better for those in the treatment centers. On, the pooled samples strategy going on in Ghana, I think I've answered this many times already. It's not a strategy that we feel is appropriate for our condition in Nigeria. It's something you can do when there are very few infections in the country, and you can manage when you have one lab. Ghana has one big lab through which they do most of their testing. And that's why today you heard they had a sudden increase in the numbers, because they wait, collect all the samples, test them at one time in one big lab that they have, and then release all those results. So things like that are a little bit more complex in Nigeria. So we've decided to carry out our own strategy. It was slow in starting, but we are now scaling like everybody has said. Everybody realizes. I think the last question is really, the allegations that anybody is collecting money for testing. To be honest, I can't vouch for everybody, but nobody in NCDC will collect money for testing. Not during this outbreak, not during any other outbreak. So if there's any validity to that statement, but it wouldn't be right that everybody that posts a message on any social media platform is considered to be true before it is rebutted. These questions, nobody will collect. A simple answer: we don't collect money for testing. We never have, we never will, in terms of the work that we do in public health emergencies.
So I have, a few questions. The first one had to do with, I think there was a question about ventilator survival. So really, if you have COVID infection, you don't want to go on a ventilator. The outcome is pretty poor. Even in the best health systems, 50% survival. There have been series that have shown 20 to 30% survival coming off a ventilator. So that is why it's important in the first instance not to even get COVID. Because if one gets COVID and you happen to fall within the risk groups in terms of immunosuppression, or the elderly, or diabetes, or cardiovascular disease, and you end up on a ventilator, you have a greater chance of not coming off the ventilator, even in the best health systems. And that's why people have been dying outside in Europe, in the United States, etc. Most of the deaths have been linked to ventilators. We have very few ventilators in the country anyway. So the 20% that we talk about that will require hospitalization are those that will require oxygen. And about 25% of them, 5, would require ventilators. But you don't really want to be in that group. And that's why we keep on emphasizing on the prevention aspect. Prevention is better than cure, and it particularly applies to COVID infection. In terms of clarification of the curfew, yes. Of course, journalists are exempted. But I'm surprised that you're having issues. We will release a specific clarification, and we'll be meeting with the security agencies, I think, on Friday, and we'll make it very clear. People on essential duties are exempted from the curfew. For the gentleman who lost his, I think it's mother or father, I think it's his mother, and needs to travel interstate. Yes, if you recall, we made it very clear that interstate travel is not allowed except for essential. So non-essential travel is not allowed. So I think when it comes to transporting a deceased person, that would be considered to be essential. And do get in touch with us. We'll be able to provide you with the necessary documentation to allow you to take your mother. And we hope she finds peace wherever she is. Thank you.
Well, regarding to the question of whether the figure we quoted was in Naira or in dollar, perhaps I may use the opportunity to give you our own estimates in civil aviation based on what we have, the trend of events prior to COVID-19. The total loss is about 21 billion naira, approximately, plus about 3 billion naira tangentially. And this is divided in this form: 7 billion for aviation agencies, what they lose in a month; 10 billion for airline, and 4 billion for ground handling, catering, etc. And then the tangential 3 billion. Then also, just since you're interested in dollars, I've got from IATA here an information from IATA Economics. IATA is the International Airline Transport Association, and they've given us impact or economic impact in Africa's largest aviation markets. That for Nigeria, lost airline revenue, this time around only airline revenue, is $994 million. And in terms of employment at risk, in Nigeria is 125,370. Loss of contribution to the GDP of the country is $885 million. Now these are IATA figures. And finally, to say that because it is service nature, service industry, it's not like Honorable Emeka Nwajubo's shop in Aba, which I know he has. If he's not able to sell his spare parts, they are there. It means it's only a delayed income, so to speak. But because the airline is servicing, I have not provided the service. I am able to do so. You have not flown, so I've lost it. I cannot regain it. I cannot sell it tomorrow. The one I sell is tomorrow, is meant for tomorrow, and there's no way I can come back up with it. So this is the situation of civil aviation. It's really a pathetic one. We're all crying, and I can guarantee you several airlines are not going to come out of this, unfortunately. Thank you.
Honorable Minister of Humanitarian Affairs.
Thank you very much. The question is around the issue of the persons with disabilities, as alluded to by the chairman of the albinos. I want to state here that the palliatives that we take to states, we make sure that we stress to them that these palliatives are meant for the poor and vulnerable, including the persons with disabilities. But that notwithstanding, since I assumed office as the Honorable Minister of Humanitarian Affairs, I've made persons with disabilities as a priority for me. And upon assumption, I immediately appointed an SA on disabilities. And he is to coordinate and liaise with the PWDs in Nigeria. And one of the outcomes of that liaison is the stakeholder meeting that I held with the leadership of this particular special group about 2 weeks ago. And the outcome of that meeting was I constituted a technical working group that will come up with the modalities for the implementation of these palliatives to these different groups as a kind of addition to what we have already done to the states. And I'm still waiting for the report of that particular TWG, which the chairman of the Albinos Association is a member of that TWG. So I think I should be asking him, where are we? Because I'm waiting for that report for us to see how we can take this intervention to these different clusters of these PWDs. Thank you.
Honorable Minister of Information and Culture.
Thank you, Mr. Chairman. I think there's a misconception here. The committee that was set up today was a committee of stakeholders of the creative industry and not just for the Broadcasting Organization of Nigeria. Having said that, the last time I checked, the Broadcasting Organization of Nigeria is the umbrella body for broadcast stations in the country. And it's not correct to say that there's only the chairman of the organization that is a member of this committee. President Daniel Aboki from Cool FM is also a member of the committee. And I want to say that the people you refer to as comedians and entertainers, they're actually the people that oil the broadcast industry. They are the people that provide content. And without them, there will be no broadcast industry as we know it today. Now, the committee I set up today, like I said, is for the creative industry, which is very wide. It has television, film producers, artists, musicians, actors, record label managers, and representatives of the fashion, photography, hotels, travel industry, as well as publishing. This is a very representative committee, and I urge members of the Broadcasting Organization of Nigeria to take advantage of this committee to come up with measures to mitigate the effects of the pandemic on the entire industry. The issue of journalists being prevented from doing their work in Lagos, I will take up the matter with the Commissioner of Police in Lagos, because my understanding, and I think it has worked so far, is that anybody with a valid identification as a journalist is allowed to move about unmolested. The third question, which was more like a comment, is the issue of Mr. Carter. I will continue to put pressure on the state government, but the only way out is if the state government withdraws its case. Thank you very much.
Minister of Foreign Affairs.
Thank you. Yeah, there were three questions that were asked. The first one is on this payment system for the flight from London. And I'm glad you actually raised this because one of the issues we're facing with the payment for the flight from London is that our agreement with British Airways is that it will be paid fully by tonight. So it's been slow because we're to pay back as we get the payments made for the tickets. And I think one of the reasons why it's been slow is because, of course, just like you, some Nigerians are a bit apprehensive about this outsourcing and this online payment to this person. But it is genuine. So, for anybody who is watching in London, who's having cold feet about going online and paying to that site, should please do so, because we're negotiating with British Airways whether they can give us a small extension of time. So hopefully, because we know there are just so many people in London who want to come back, and just to say again that is a genuine agent of the Nigerian High Commission in London, mandated to collect payments for the British Airways flight on Friday. The second question was on palliatives for Nigerians in South Africa. Well, that's an interesting one. I mean, by extension, we might as well give palliatives to Nigerians all over the world. I mean, I think it's not, there's no possibility, I'm afraid, of that. We do sympathize with Nigerians everywhere in the world, not just South Africa. We know, the suffering that so many of our people, kith and kin, are going through, including right here in Nigeria. But it really would not, I don't see how it would be possible if our High Commission were resourced in such a way that they could do that. We could have contemplated that, but as you all know, our High Commissions and embassies around the world are also facing enormous resource challenges. So I'm sorry that the palliatives that the Honorable Minister of Humanitarian Affairs is really destined for Nigerians here in Nigeria. The third question was regarding China and the fact that Nigerians who are there have valid tickets on an airline, and why should they pay again if the same airline or a different one brings them back, when they could, that the government should somehow implore the airline, in this case Ethiopian Airlines, I understand, to bring them back and carry them on the basis of the tickets that they already have. Well, the reality is that there's a difference there. These flights are chartered flights, essentially. They're evacuation flights. They're not normal commercial flights. So obviously the Nigerians in China have tickets for a regular commercial flight. Now, if Ethiopian Airlines agreed to evacuate Nigerians and come back and bring them back to Nigeria, that would not be a normal Ethiopian commercial flight. And so understandably, they would not agree that a subsisting ticket for a commercial flight could be used on that charter, on the charter flight of Ethiopian Airlines. So that's the basic reason why the tickets cannot be used for these evacuation and emergency flights. So the only advice one can give is to keep those tickets and use them when, by God's grace, this pandemic will be over. Thank you.
Thank you very much. We will skip the Honorable Minister of State for Education, and I will now invite the SGF to the podium.
Thank you. I think most of the questions have been answered. I will just gloss over a couple of the questions, but the details have been given by the various ministers and the DG and the national coordinator. Amaka, you asked whether we have tried all the local solutions. I mean, the Honorable Minister of Health has answered that quite expressly about the need to subject whatever has been established in terms of either produced, invented, to some protocol of validation. That has to happen before you allow people begin to consume things that have not been validated by way of the processes through which it's supposed to go through. And I believe the Federal Minister of Health with his agencies have established those processes. There are agencies of government that have responsibility for validating those kind of produce. I know the National Institute for Pharmaceutical Research is there, the Nigerian Institute for Medical Research and NAFDA are all agencies of the Federal Ministry of Health that have the statutory responsibilities to deal with those things. If there are items that are being invented or created or manufactured, we have the Standard Organization of Nigeria that is supposed to even cross-check and see whether those items that have been created or manufactured meet the required standard for it to be released into the market. My appeal, like I've always done in the last couple of days, is encouraging our researchers and our inventors to subject whatever they have gotten to the proper protocols of validation. The issue of curfew, I think that has been dealt with, which is also related to whether vendors and journalists are not exempt from, are not considered as essential services. I believe they are, because whatever we do here, if you don't report it, then the news item will not get out to the population. The adverts we carry on the radios and on television that is supposed to enhance and equip our people with knowledge and information so that they can take informed decisions will not go out there. So I believe that anything related to press is considered as essential service for the purposes of allowing you free passage. We'll look at the issues that happen in Lagos, and I believe that the Honorable Minister of Information will take up that, because if we expect the networks to remain or operate 24 hours or throughout the night, then when it comes to movement, our security agencies should be adaptive enough to know that these people are coming from their places of work and grant them access to get home. Okay, we will look at that. We will look at that if it is the release of the protocol that did not consider that. I believe that a national coordinator who has the primary responsibility of dealing with that would take a look at it and see how base. Because you need the medical professionals to go and have a rest so that they can refresh and come back with renewed vigor to continue with their assignment the next day. Same with any other person that would have worked a period of 12, sometimes to 14, 16 hours. I think we will look at it and see if it is the narration that did not provide for that. The national coordinator should be able to give the appropriate clarification for the purposes of enforcement. Well, the Honorable Minister for Health has also, because the questions were being referred to virtually 2-3 of us at the same time, he's spoken at length on the issue of private clinic accreditation, particularly the correspondent from, a reporter from Liberty did ask after he had stated the fact, which is when our people are afflicted, the first point of call are the private health facilities that are within their community. I agree with that. But because of the nature of COVID-19, not any and every health facility is properly equipped to deal with those kind of situations. And I'm very sure that is one of the reasons that accounts for the high prevalence of infection with medical and health services workers in the front line. because there is a lot of protocol around dealing with infectious diseases. That I visited the ones in Lagos and even the ones here. There are red lines you cannot cross. Even if you walk in that establishment, there are boundaries you cannot cross unless you are fully kitted. And the kitting is even different from the ones that deal directly with the infected patients, from the ones that are providing only the complementary services in the facility. They are marked, there are red lines, there are yellow lines, there are all manners of lines. So it's highly restrictive in its organization. And if you cross any of those lines, you can endanger yourself by getting infected. So it is a thing that we do not, and that is why the Federal Minister of Health has insisted on accreditation. We have to see your facility. We must ensure that you can provide for this categorization in that facility before you be allowed, in your own interest, to take in cases that can portend danger to yourself and other patients within your hospital environment. The other question is, well, I will return, the universities. There was a question that had to deal with universities. The Honorable Minister for State Education has asked me to take that. Universities, to the best of our knowledge, don't charge tuitions. So I'm not very sure it's tuition that the university you mentioned charge. It could be some other charges depending on the university, but tuition is not what universities are being permitted to charge. Rachel, next time you hear this kind of, I wouldn't say it's fake news, but the truth about it, I know what it does to somebody who is working his heart out, going around exposing himself and collecting samples. That's one of the most dangerous activity in the management of COVID-19. With an established patient, you already know his status. But with those that you are going to collect samples from, you don't know their status. So it calls for absolute diligence. You must be prepared and trained for it. And you are just out there in the war front, not knowing what would happen to you. And some people will take delight in saying that you demand for 30. How many Nigerians can afford 35,000 naira to take a sample? If it were even 1,000 or 2,000, I would understand. So next time, let's verify these stories, because it does a lot of damage to the morale of the people that are out there working to keep us safe, to help us navigate this very difficult process in which we have found ourselves. It will do us a lot of good if you find out, do a double check to establish the veracity of that kind of allegation. And if you establish that it's not true, don't even bother to ask of it. Because they are in their homes now, some of them getting ready to start their night duties, some of them are in their places of work, they are watching this. And I know, as a human being, what will be going on in their minds. I will leave my family, expose myself to this danger, and all I get is an allegation that I'm asking for 35,000. What is 35,000 compared to the risk that they are taking? Mine is a passionate appeal that we are all together in this. And truly, today I'm a little bit sober because of the dangers that I see ahead. And I refer to it in my speech. In paragraph 6, I said, early assessment of the ease of lockdown phase indicate that Nigerians are yet to come to terms with the deadliness and the virulent nature of COVID-19. And this gives us concern on the high possibility of increased seeding of the virus to hitherto unaffected persons and populations. And I went ahead to mention some of the worries. One of it is total disregard for the protocols that government has issued: social distancing, wearing of masks, personal hygiene, ban on interstate travels. We've just thrown them to the winds. And I concluded with a very subtle reminder, not in the characteristics of a president who would say 100,000 would die by this month, but I concluded with a subtle reminder in my paragraph 15. I said the overall assessment of compliance with the measures and the outcomes of modeling we have developed point in the direction of danger ahead. I want to emphasize that so that we know that we are not playing. It's a very serious and it's a very sober thing to reflect upon. I say it points in the direction of danger. But I proffered a solution by saying, how do we avert it? I went further to say, we therefore need personal discipline, increased awareness and enforcement. And I went ahead to call on the community, religious and traditional leaders to take up this challenge. Similarly, call upon trade associations, professional bodies, organizations to complement the efforts of government. I acknowledge that they have been doing that, but I concluded by saying it is obvious we need to do much more. I conclude with this. It is obvious we need to do much more because we have the collective responsibility to own up to this fight. It is not the federal government's fight. It is not your state government fight. It is your fight for your life. It is your fight for your life. So when we say stay at home, when we say put on a mask, when we say observe social distancing, it is not to protect any of us. It is to protect you first, and by extension, protecting your loved ones and your community. My passionate appeal that we cannot go on like this and expect a different result. Thank you.
Thank you very much, the SGF. We have come to the end of today's national briefing. It is true that we cannot go on like this and expect a different result. That's message number one. We must imbibe self-discipline. Message number two is always there. Please wear a mask or a covering when in public space. Observe all the protocols totally. Message number three is that we urge all Nigerians to also use this period of the pandemic to build social solidarity by eschewing stigmatization, support the mental well-being of our compatriots that are infected, continue to provide for the poor, the sick, the aged, and the vulnerable, and render whatever help you can at all times. Finally, please do not go into hiding if you suspect any infection or feel the symptoms. Go out, seek help from the appropriate medical facilities. Do not practice self-medication. It is in your interest and it is in the interest of your loved ones. I thank you very much. God bless Nigeria. We hope to see you tomorrow by the grace of God.
That was the PTF briefing on COVID-19. We're going to continue with Nationwide in about now. After the initial disinfection of public places, the Federal Ministry of Environment has issued certificate of decontamination to ministries and agencies of government, as well as private organizations in the Federal Capital Territory. NTA Fine Face reports that the certification requires substance of health, social distancing, and other protocols to prevent contamination of the certified locations.
The washing of hands, the social distancing, and everything else, and keeping track of people that will be visiting that premises, and also keeping track of anybody that may exhibit symptoms of COVID-19 within that premises.
The Nigerian Television Authority NTA headquarters is among the certified locations in Abuja. The Northeast Development Commission has donated 2 ambulances, medical equipment and food items to Taraba State government to mitigate impact of COVID-19. Joseph Zana Gambo has details.
Presenting the keys of the 2 ambulances to the Taraba State Deputy Governor Haruna Manu, the team leader of the Northeast Development Commission, Yarima Mohammed Yoshua, said the items, when put into use, are expected to mitigate the impact of COVID-19 in the state.
We have earlier promised that when we are bringing the ambulances, we are going to give you 50 beds. Unfortunately, now they are out of stocks, but we promise. Then in their place, we bring 200 apparatus, thermometer, for testing of temperature.
Other items donated include 200 packs of infrared thermometer for testing of temperature. The State Deputy Governor Haruna Manu, who received the items on behalf of the State Governor, commended the federal government for the measures adopted so far to curb the spread of the coronavirus pandemic in the country. The Deputy Governor assured that the items will be judiciously used for the purpose intended.
Already we have 2 isolation facilities, and the governor directed that the ambulances should be deployed to those isolation centers that we have here in Taraba State.
The Northeast Development Commission had earlier donated food items to the state government. In Jalingo, Joseph Zanagambo, NTA News.
Nitaire Ikpeng is still at the venue of the PTF briefing for COVID-19, and he will give us highlights of the briefing. Nitaire, give us an overview briefly on the briefing.
Major highlight of today's briefing is that the Presidential Task Force has extended the ban on all flights, whether local or international, for the next 4 weeks. And this is despite easing the lockdown on Nigerians. And also the Presidential Task Force today continues to express concern over the total disregard of its guidelines and its guidelines by Nigerians. And it says this is worrisome, and it continues to appeal to Nigerians to take cognizance of these guidelines, and appeals to religious and traditional rulers to step in to create more awareness among Nigerians on the coronavirus pandemic and also on compliance of these guidelines. I have joining me at this time the National Coordinator of the Presidential Task Force, Dr. Sani Aliyu, who will throw more light on why there is disregard for these guidelines. Dr. Aliyu, is it the disregard for the guidelines, is it an issue of orientation or an issue of enforcement?
I think it's more to do with awareness of risk, perception of risk. As you know, coronavirus is not something that if you come out of your house, you will meet it, you will see it, and therefore you'll be afraid. It's a hidden enemy. And in a way, it's very difficult to change people's behavior just like that. I think what we need to do is to continue to push for more and more awareness campaigns across the country to let people know that really this illness is serious. It's a very serious issue. It kills, especially if you fall within the risk groups that we've always talked about. And even if you don't fall within the risk group, you could end up carrying this to your loved ones that could end up getting infected and getting extremely sick. We've seen what is going on in other parts of the world where people are dying. There are countries that have had more than 1,000 deaths every day from COVID infection. And even here in Nigeria, we have almost about 100 people that have died from COVID infection. So it's certainly not a joke. It's something that we need to make sure that we comply with the guidelines. One of the reasons why we lifted or we eased the lockdown was partly because of our expectation based on modeling studies that if we continue to apply those guidelines consistently, because when I say wear a mask, wash your hands, sanitize your hands, keep a safe distance, no interstate travel, etc., we need those bits, those elements delivered together rather than choosing one and leaving the other.
Okay, thank you very much. So that's it from here. The message is that the coronavirus pandemic is not a joke and that Nigerians should stick to the guidelines released by the Presidential Task Force. It's back to the studio.
Thanks, Mitari, for that overview. The Ministry of Foreign Affairs says the federal government has commenced the process of evacuating willing Nigerian nationals outside the country in accordance with global best practices and guidelines by the Federal Ministry of Health and the Nigeria Center for Disease Control, NCDC. In a statement, the spokesperson of the ministry, Ferdinand Nwonyi, explained that the evacuees on arrival in Nigeria will undergo a mandatory 14-day supervised quarantine in a monitored environment. The scheduled evacuation of the first batch of 265 Nigerians from Dubai, United Arab Emirates, will be conducted by Emirates Airline, and the evacuees are expected to arrive Murtala Mohammed International Airport, Ikeja, and Lagos on Wednesday, 6th of May 2020 at 3 p.m. The ministry wishes to further inform that adequate arrangements for hotel accommodation in Lagos and Abuja have been made for the evacuation exercise. The selected hotels have been inspected and certified by the Port Health Services, Nigerian Civil Aviation Authority, Nigeria Center for Disease Control, Office of the National Security Advisor, and Ministry of Foreign Affairs. Furthermore, discussions are ongoing with British Airways through the British High Commission in Nigeria to evacuate about 300 Nigerians from London on Friday, 8 May 2020. The British Airways flight 9155 will depart London Heathrow Airport, Terminal 5 at 7:10 a.m. and arrive Lagos at 10 minutes after 1, same day. Additional arrangements are equally being made with Ethiopian Airlines to facilitate the evacuation of another batch of evacuees from New York to Abuja on Monday, the 11th of May 2020. The federal government wishes to reassure Nigerians of its unwavering commitment to ensuring the welfare and safety of all citizens. Zinret is standing by to give us update on violators of inter-border closure in Jos. It's over to you.
Thank you, Lydia. Good evening and welcome to Jos. As Plateau State enters another phase of lockdown, the new Commissioner of Police in the state, Edward Egbuka, has commended the people for complying with the call to check the COVID-19 pandemic. This came after the assessment tour of the Jos metropolis by the Commissioner and members of the enforcement team. Caleb Guchin reports.
The Plateau State Police Commissioner's tour of Jos Bukru Metropolis, being his first, is incidentally coming on the heels of the COVID-19 pandemic, which necessitated the lockdown placed on most states of Nigeria. In all areas visited, the call for people to stay home would be seen to have received the expected desire as the roads were virtually deserted.
To refresh the memory of the good people of Plateau State and commuters within the state. Our state boundaries have been closed. Intra-local government boundaries have been closed. This is for the safety of all. I would also like to add that the law enforcement agencies or agents on ground have been warned to be polite but firm in enforcing this all-important national assignment.
Mr. Egbuka also reiterated the need for understanding among the citizens and law enforcing agencies.
In line with the Inspector General of Police observation and directives, we will not tolerate, I repeat, We will not tolerate assault or harassment of any of the officers enforcing this duty. In the same line, the officers have been cautioned to shun corruption, shun being high-handed, particularly at the